Good morning, everyone. 17 minutes after the hour. Welcome back to the Sunrise Show, and thrilled to welcome into the studio Dr. Shawn Sills. He's the founder and Touchstone Pain. TouchstonePain.com is the website, but it's Touchstone Interventional Pain Center. They're over on 2925 Siskiyou Boulevard here in Medford. And the phone number 541-773-1435. And there's so many incredible scientific great things that are going on. And Dr. Sills, thanks so much for being in this morning.
Good morning, Craig. Thanks for having me.
You know, this is when you talk about what Touchstone Interventional Pain Center does, and there's new technology we want to talk about, and you're also the medic director over at ARC Detox Center, and that's a fascinating, talk about boots on the ground, being right there, seeing what is going on in our community. The insight you have probably can't be compared to any, but with Touchstone Pain, talk about this interventional pain center, because you've got this incredible technology, this HF10 spinal cord stimulation, this high frequency. We'll get to that. But people are suffering long-term pain, chronic pain. What are you seeing? And you mentioned heroin. Huge.
Yeah. What I do is interventional pain management. And what that is basically we use minimally invasive procedures to try to target pain generators in the body. So sometimes we'll inject medications like steroids to relieve inflammation. Sometimes we'll numb nerves as a precursor to burning nerves. The most recent technology that we started using about 10 months ago that was recently FDA approved is called high frequency spinal cord stimulation. And what this is stimulating really fast over the spinal cord with electrodes, and for whatever reason, that high stimulation will block out pain. And what we see is patients, after 2 or 3 days of having the electrodes placed, will have pain go from like an 8 or 9 down to like a 2 or a 3. And so what this is in a time when we're really trying to push away from opiate medications to manage pain,
right,
we have something that actually is very effective, and something that actually we've hit many home runs, and that's hard with chronic pain. It's hard in chronic pain to do a surgery or procedure where patients will go from like an 8 or 9 down to a 2. But we've had in the trials, and then also our own clinical experience, we've had dozens of patients who have been in severe pain and go into a state of what we call pain remission, where their pain really is minimal, 2, 2.5, 3 out of 10. And so, we're fortunate to have this technology.
This is amazing, because in the world of, medical marijuana, we don't want to get lost over there, in those weeds. But what you do in your surgery, and this is for severe back pain or severe leg pain. And so these electrodes are, the spinal cord, right? You don't tap into the spinal cord, but around it, because it's pressurized.
Yeah, the electrodes actually don't go in the spinal cord. They go right behind the spinal cord in what's called the epidural space. Okay. And so, these are patients who maybe have had back surgeries, back fusions, other chronic back or leg symptoms, neuropathy.
I guess it's sciatica. That's
sciatica,
a huge piece, right?
And anything that doesn't respond to conventional therapy or hasn't responded to surgery. This is something that can be a game changer.
That's amazing, because up until now, it's been, prescriptions have been oxycodone, OxyContin.
Yep.
That's been over the counter for long-term pain. And then of course, for folks that are going in the black market, there's heroin and, methamphetamine. Yeah. And then you try to get them off of that and go to the methadone, right?
Yes.
So, the methadone clinic. And then here you've got this. And the interesting thing is, though, addictions through Oregon Health Plan or OHP, you said no problem, but this is covered under Medicare.
Yes.
Okay, but and this is one thing, chronic pain, tough to handle under insurance, but it is covered under Medicare, Medicaid, right? So that's interesting. That's very cool.
Yeah, what we found with just back talking about the other approaches to treating pain, the medications we found were limited. The opiate medications the last 10 years, we we were encouraged to be more liberal. And what we found over time in studies and now looking retrospective is the pain medicines just don't work that well. What happens is patients get tolerant, they
I
get
was going to
dependent.
say there's the tolerance level. Exactly.
And then what we've seen is that over time, not only is there tolerance, but actually it seems like it makes patients more sensitive to pain. So that coupled with studies that are showing that the opiate medications are linked to increased mortality and accidental overdose, there's been a real push away from the opiate medicine. So that's what we try to do at our pain clinic at the Interventional Pain Center is try to move away or limit the role of medications and move towards modalities like spinal cord stimulation.
This is just fantastic. We're talking to Dr. Shawn Sills, and he's the founder of Touchstone Interventional Pain Center, touchstonepain.com. They're over on Siskiyou Boulevard. 2925 Siskiyou Boulevard. The phone number 541-773-1435. Shawn, what's the process of getting into this spinal cord, this HF10, this spinal cord stimulation? I mean, appointments, you've got to get in and check that out. What's the process
The process is basically if you have chronic back or leg pain and it's been unresponsive, it's intractable, just have your primary care physician send a referral over to the clinic. We'll evaluate you, see if you're a candidate, get pre-authorization with insurance. The way that the STEM trial or the STEM process is done is we'll start first with a trial. So what we do is we place the electrodes through a needle temporary for 1 week, and we leave them in to see if it works for your pain. It doesn't work for everybody.
Right.
We've had... probably it's about 8 out of 10 it works for relieving at least 50% of their pain, but 2 out of 10 just won't get relief.
Well, yeah, and think about if you can reduce your pain meds in half.
Yeah.
For anyone that's out there popping pills and doing whatever on a regular basis, and, there are consequences. I mean, there's stuff that they just simply can't do when they're on pain meds, right?
Yeah, we've had right away a few patients come to mind that were on a lot of medications, including methadone and others, to try to treat pain. Young people, and it wasn't really that effective. And we did the stimulator implant, and their pain went down to a 1 or 2, and we were able to get them either down or all the way off their medication.
Wow. And then you would translate from, say, a methadone or Oxycontin to maybe a Tylenol or something.
Yeah.
Right.
I mean, we rarely use this word in pain management, and it's a concept of remission, pain remission. For the first time, we've had patients who we've done a procedure and hit a home run where really their pain is so minimal they don't need anything more than a Motrin or a Tylenol, if that.
That's amazing. And, I tell you, we've spent a lot of time talking about marijuana. I've talked about, long-term pain. And I always say I'm not in their shoes. I can't even imagine. I know what I'm like with a headache. Yeah. When it comes up, it's just dilapidating. I can't do hardly anything. And then you think when the headache won't go away after about 3 or 4 hours, I'm like going, I've had it. I'm done.
Mm-hmm.
So imagine someone that's got 24/7 pain and they can't get any sleep. What do they eat? Where do they sit? Where do they stand?
Mm-hmm.
And it just repeats. And they are looking for pills, and so this is fantastic. Ladies and gentlemen, Dr. Shawn Sills. We'll be right back. We got to get to a break, and then we'll talk more about what's happening with this. This is a fantastic breakthrough, and it's right at Touchstone Interventional Pain Center here in Medford, over on Siskiyou Boulevard, touchstonepain.com. We'll continue after the break. We'll take your calls as well, 541-772-8255, here on the Sunrise Show on News Radio 880 KCMX. Good morning, everyone. Welcome back. 33 minutes after the hour. It's the Sunrise Show on News Radio 880 KCMX. And continuing with Dr. Shawn Sills from Touchstone Interventional Pain Center over on Siskiyou Boulevard. Their phone number 541-773-1435, and their website touchstonepain.com. And Dr. Sills, this is fascinating. We're talking about this HF10, this spinal cord stimulation, SCS HF10, and it's just fascinating to think that folks can get out of their pain meds. And during the break, we were discussing this whole issue of the percentages have drastically increased as far as success rate, and this, what is this, paresthesia, tingling, is completely gone.
Yeah, we've had spinal cord stimulation for years, probably 20 plus years, but the old stimulation was limited in the fact that it wasn't quite as effective. It produced a paresthesia, tingling sensation that sometimes would be pleasant, but sometimes you would turn and it would be an unpleasant, shocking type sensation. And it was a technology that worked great for leg pain, but hit or miss for back pain. The new technology is what we call paresthesia free, which means that patients don't have that uncomfortable, shocking sensation that they had with the old technology. The other thing is, we can cover back pain just as well as we can cover leg pain. And the other advancement is, for instance, neuropathy. A lot of patients suffer from neuropathy, diabetic-induced neuropathy, burning, tingling in their feet. Really, we've had very little as a medical community to offer these patients. The medications really don't work that great. But with the new HF10 therapy, we've had several patient testimonials of a phenomenal relief.
So talk about that. I mean, what are folks saying when they finish this up? I mean, this is fascinating. Of course, like I said, you first test them to see if they're a good candidate. You for a week, you put some electrodes in their back, right? And then if it works, they get a battery pack.
Yeah.
And it's actually, it's brought into, is it actually surgically?
It's implanted, yeah. What happens is after the trial, if you get at least 50% reduction of your pain, we move forward with the implant. 2 small incisions, one incision in the midline of the back to place the electrodes, the other off to the side where we implant a pacemaker-sized generator. So it's a small surgery. It's outpatient. It's not that invasive, but it's still a surgery. In light of patients that have done well, several jump to mind. One fellow in particular, one of our first ones that we did, severe peripheral neuropathy from diabetes, couldn't walk. His feet were so burning. He couldn't walk. His calves were all atrophied. We did the STEM trial, and he comes back to our office, and he's like, "Doc, I not only could I walk, but I found out I could dance." And
now, wait a minute. He'd been in a wheelchair or something. I mean, if he can't walk and his calves were atrophied, that means he'd been off his feet for how long?
For years. And he also said, my knee pain from arthritis went away. His insulin doses were cut down in half, and he had, about 80-90% change in his pain. He was very happy. So we ended up implanting him. Same thing with the implant. Great relief. We've had several patients in that category with severe neuropathic pain in their legs that before we had really nothing to offer them. And now we have something that can make a huge difference.
Because at some point, the meds, they'll numb it. But like you said, the tolerance level goes up. They have to up their, and the doctor may not increase their prescription, right? So at some point, they're really dealing with some horrible pain.
Yeah, what we've found is that over certain thresholds of doses of medications, your chance of accidentally overdosing and dying goes up. So the CDC 2 weeks ago released new guidelines recommending that as physicians, first of all, we try not to prescribe chronic opiates, and then try not to go above what's called 90 morphine equivalents of pain medicines.
God, this is fantastic stuff. Ladies and gentlemen, we're talking with Dr. Shawn Sills. He's the founder of Touchstone Interventional Pain Center over on Siskiyou Boulevard, touchstonepain.com. There's some videos. In fact, we posted a 30-second video. It's a great video on our Facebook page, Sunrise on KCMX. You can check that out if you want to see what's going on. This is fantastic. So how long does it take to get into this? I mean, have you got a waiting list for this, or what's happening there?
No, not too bad. I mean, it can take, about 2 to 6 weeks to get into our clinic to be seen. But once you're authorized, the process moves pretty quick. The trial is scheduled within 2 or 3 weeks, and then